Thank you very much, and thank you everybody for your patience. I think if I thought we were going to win today, I might have actually made the flight this morning at 6:30. So my sincerest apologies for being disruptive and joining you halfway through the presentations this afternoon. We're absolutely delighted to have won the prize in engaging and championing the public. My name's Linda Craig. I'm Regional Lead for Patient-Client Experience within Northern Ireland, and we're based in the Public Health Agency. And my colleague, Dalreen Messon, was with me today as a member of my team. So just to tell you a wee bit about the project and a little bit about us. I'm entitling today's presentation The Golden Thread. And I really think it's probably the golden thread of everything that we will talk about here this morning that I have missed, and for what we'll talk about for the rest of the day. What's the golden thread in everything that we're aiming to do and everywhere that we go and in the work that we're doing? What's the underpinning thing that must be there at all times? And for us, the golden thread in this project was all about having the right people in the room. And very often that meant even having people there that we didn't know how to communicate with them, they didn't know how to communicate with us. Because what we wanted to do was look at building a process that allowed the people who use sign language to give us feedback in Northern Ireland about the experiences of health and social care. But not only to give us the feedback, but to allow us to respond. And that was really important to us. So I just want to start by telling you a little bit of the story in Northern Ireland. In 2020, we launched Care Opinion into Northern Ireland as a region, across every trust and every service, every organisation, inviting people to share their experiences on the online user feedback platform. And I would like to just acknowledge that there's no better person to come up and receive the Winners Award this morning in my absence than Sarah Ashurst from Care Opinion, as she has partnered with us since 2020, and it's just been one of those wonderful coincidences that she was in the audience this morning when I needed somebody to stand on this stage. But it absolutely just shows that the collaboration between ourselves and the Public Health Agency and working alongside our colleagues in Care Opinion is one of those solid collaborations that has brought this work together. In 2022, my colleague Dalreen Mason was doing her course called Foundations in Patient Experience with the Point of Care Foundation. And one of the things she had to do was present on a project where there was identified need and how she was going to tackle that need. And of course I said, I know this wee project would be a great wee project to do. And it turned out to be a massive piece of work that has brought so much value into Northern Ireland. On Care Opinion, we had a small number of stories told by people from the deaf community. One that sticks out really strongly was a lady during COVID who was profoundly deaf and who was not allowed to have her husband, her partner, her birth partner with her during the birth of her first child. And she wasn't able to communicate with the midwives, and the midwives weren't able to communicate with her. And then to tell her story, her husband had to do it on her behalf. And it really brought home the importance of meeting people at their point of need, and actually what we needed to do was work out how we did the communication properly. How did we reach people the way that they wanted to communicate with us? And this is a quote from Charles Dickens, A Tale of Two Cities, and it's really about how Lucy, one of the characters, brings a golden thread through people's lives, binding people together, bringing people into better destiny, being, sorry for the typo, a tightly knit community, and looking even as close as family and friends. And I think that's what we managed to achieve in Northern Ireland with the work that we did here. We brought together a community of people that wouldn't normally come together. We looked at the opportunities and worked out a process that allowed people to share their experiences on the Care Opinion website. So that was the title of our project. And here are the many people that we consulted with as part of the project. So what was really important was our key partner in the British Deaf Association, our key partner with Care Opinion, our key partner with Sign Video, which was a process that we had brought in, allowing people to use any telephone number within HSC Northern Ireland to be able to communicate with the services. We needed to have on board all of our charitable partners from the National Deaf Children's Society, RNID, ourselves and the Public Health Agency, but also acknowledging Health and Social Care Northern Ireland, so the services themselves. Really key people in the corner there, the translators, the interpreters. And here in the centre is actually not a great graphic in terms of the deaf community in Northern Ireland. And we had quite a number of forums to which we were able to engage with to ask them, how do we best achieve this process? So that was our aim, to develop a mechanism for people to share their experience in health and social care in sign language, but also to receive a response in sign language. We wanted to know what mattered most to sign language users. We wanted to explore what functionality was available. We knew what care opinion could do. We knew what health and social care were not doing. And we needed to stand in that gap and work out what exactly had to be put in place. We also knew we had to pilot it and pilot it and pilot it again, get feedback and pilot again and reconsider the process and return to the process. And in total, this probably took us about 9 months. But what was really important, and I think that's the learning that comes across in every element that we're going to do taking forward now. First of all, at every stage of the project, we needed to build relationships. We knew that when we spoke to the deaf community that they did not trust Health and Social Care Northern Ireland. They've been fighting to give feedback for a very long time in a meaningful way. And therefore, there was a sense of needing to build the relationships. And Dalreen was seen to be doing coffee and teas at many's a Saturday morning meeting to build up those relationships and learn to trust each other, that we were there with the right intention and that they would be listened to and would shape the process. So there was an agreed purpose, what we all wanted to set out and do, and there was open communication. That being a safe space to say exactly what we thought, because we had to work within parameters too of cost, which comes to everybody, in terms of what the platform could achieve for us, in terms of what we could do in Northern Ireland, what translators could do for us. And we also needed to challenge assumptions, and I put that one in there for myself, because the day in hour I gave Dalreen that sense of, here's a wee project to do, I actually thought I was giving her the solution and she just had to sort of pinhole it into the presentation that she had to do for her project. But my solution was nowhere near good enough. My solution was, we have a telephone number, there's a telephone number, they can ring each other, we'll get the feedback, and sure, that's great, and we'll run off and learn. But in that sense, no one was able to tell their story in their language. They weren't able to see the story in their language. They weren't able to get a response from the service in their language. And that was one of the most important things, was that absolute assumption that, we have to meet people where their communication needs are. So I've already talked a bit about the process and what we set out to achieve. Where we at now, we've just reviewed the final changes with the key stakeholders. We've tested this process several times, and so how it works is someone who wants to tell their story using sign language will use signed video. Signed video will call care opinion will upload it, and the Public Health Agency gets it translated. And that all goes onto the platform as a very open and transparent process, one to which everyone can see. And I'm happy to say that this week we've just finished co-producing our video to promote this with the deaf community and get it onto the British Deaf Association websites and across all of our key partners. So, I'm hoping I'm near an end, saying as Ruth is beside me. Many of you will probably know this analogy. I just wanted to reinforce it today. You may be aware of the practice within Japanese culture where they take gold to repair something that is broken, in the belief that once you put it together in gold, that it will be stronger. And I would say most of us here today have a sense of looking across our services and feeling at times, is it not a little broken? And what I have learned from the project that we have done today, or that I've presented for you today, and that we're very grateful to have won the award for, is that it really did take the voice of the service users and the deaf community to help us shape our final process and just to come up with something much stronger at the end as an end result and outcome. And just my contact details if there's anybody wants to talk to us. And there will be a poster, it's just not up yet. It's still in a folder.
Perfect. Thank you so much. Thank you, Linda.